I study the disease osteoarthritis, which is a joint disease. It usually affects the knees and the hips, and it affects more people as they get older. So around 8% of New Zealanders are affected by arthritis, but almost 50% of New Zealanders experience osteoarthritis over the age of 75. And I look at the earliest phases of the disease before patients start to develop pain. It's difficult to study this stage when patients don't feel pain. So how do you get someone who doesn't experience any joint pain to come into the lab and let us test their joints and collect samples? You can't. You can collect samples from people after they die, or you can collect samples taken from surgery after you've had a joint replacement, but getting samples in the early stages of the disease is quite difficult. So we can actually use samples from an animal. In New Zealand, we have a large dairy cattle industry, and dairy cows live for quite a long time and start to develop joint degeneration. So we can use cows to study some joint degeneration and osteoarthritis. So I mechanically test the cartilage and the bone underneath to try to understand what changes first. Does the cartilage change first, or does the bone change first? And if we're able to understand how the disease develops, we then might be able to detect the disease sooner, and only then could we be able to develop technologies to prevent the disease from getting worse, so to prevent your joint pain from ever developing. So through my research, we've been able to detect microstructural changes and changes in the stiffness of the bone underneath the cartilage that maybe one day we could detect non-invasively, so you don't need a biopsy or a surgery to detect the disease.